everyone. My name is Jessica Charles, and the title of my project is Dysregulation of Barrier-Related Genes in Atopic Dermatitis. Atopic dermatitis, also known as eczema, is a common chronic inflammatory skin disease that can be characterized by immune dysregulation and disturbances in the epidermal architecture. These disturbances are associated with skin barrier dysfunction and cause an increased susceptibility to bacterial infections and allergen exposure. Various factors, including genetic mutations, allergens, and infection, are believed to influence the development of the skin disease. Several studies have identified gene dysregulation when analyzing AD samples. However, there is still limited knowledge on genetic disturbances associated with the disease. The purpose of this study is to analyze differential gene expression using RNAseq to determine dysregulated genes and how their pathways connect to commonly displayed symptoms of atopic dermatitis. I hypothesized that dysregulated genes revealed in the analysis would be those involved in normal barrier function. RNA-seq analysis was conducted on a publicly available dataset acquired from a data repository. The raw dataset contained 147 samples, and this study focused on 21 lesional and 21 non-lesional AD samples from adult patients. Some of the inclusion and exclusion criteria for choosing patients can be seen in the cohort determinants. I performed principal component analysis and differentially expressed genes were identified. Then functional enrichment analysis was conducted to analyze gene signature overrepresentation. In Figure 1, the PCA plot shows separate clustering of the two sample sites, which is evidence of different gene expression in the lesional versus non-lesional skin. In order to further investigate differentially expressed genes in lesional skin, I created a volcano plot seen in Figure 2A. It displays an overview of all differentially expressed genes in the healthy and lesional AD samples, with dots in the red region being highly upregulated in lesional samples. From there, I wanted to determine whether similar genetic profiles were present for both sample sites, which brings me to the heat map in Figure 2B. As you can see, the red region for lesional samples shows that they tend to have a similar grouping of genes that are upregulated and a similar grouping of genes that are downregulated. Focusing in on that red region, Figure 3A reveals the top 9 upregulated genes in lesional skin. SERPIN B4 is the most highly upregulated gene, and there are multiple appearances of S100 and KRT genes. Literature has shown all 3 of these gene families to be important in promoting normal skin barrier function through functions including keratinocyte differentiation. Finally, gene ontology enrichment analysis was conducted to analyze the significance of the presence of certain pathways. Figure 3B shows that the four most significantly enriched pathways were all involved in skin barrier function, including keratinization and cornification. This study adds to the understanding of gene dysregulation in the presence of atopic dermatitis and demonstrates how RNA-seq can be used to analyze differential gene expression in a publicly available data set. The top differentially expressed genes had significant enrichment in functional annotations, including keratinization and cornification. While both are normally expressed and necessary for proper skin barrier function, if overexpressed, dysfunction may result. SERPIN B4 was the most highly upregulated gene in lesional samples, and there was a high presence of KRT and S100 genes. Prior studies using different methods have resulted in similar findings, which implies that skin barrier pathways and their associated genes play a critical role in the presence of atopic dermatitis. Current treatment for AD often includes corticosteroids or immunosuppressants, which are both nonspecific and associated with high toxicity. Studies regarding this subject are critical to developing new treatment options, as novel findings regarding the specific genes previously mentioned could allow for more targeted treatment options in the future. Thank you for your time.